Hello everyone, Patrick here, and today I want to talk about something that I put off for a while. It is the disorder that has plagued me the most for as long as I can remember, my obsessive compulsive disorder, and how I got over it. Now, to be specific, I'm talking about a body-focused repetitive behavior, which falls under the OCD umbrella term. What this concerns is the biting of my lips and cheeks and the insides of my mouth, to a very severe degree, to the point of bleeding most often. So this video will get into a bit of heavy detail, so I want to give a fair trigger warning, I guess. So for anyone that has agoraphobia or tryptophobia or anything of that, just listen with caution, I guess. So first I want to describe how severe this disorder has been all the way up until around 28 and a half, about 29, until I got an actual grasp on it. Essentially, I would be biting my lips at just any random times, like the insides of my lips and the insides of my cheeks, all up and down. Sometimes I would even bite my tongue. So this was so bad at times that I would actually be face to face with someone, talking to them in conversation, and I would wait for them to avert their gaze so that I could take my finger and push it into my lip to get a better bite. Just very hardcore compulsions, very out of control feelings, and that was all unconscious. Like I wasn't consciously thinking like, let me wait for this person to avert their gaze. I mean, this is just like a complex that I had subconsciously developed over the years, and again, this goes back as far as like way back into my childhood before I can remember any sources of where this came from. So there was no kind of like therapy that I could go through that would help me like work through any childhood traumas that may have triggered this, is what I'm trying to say. So first I'm going to give an official definition of the condition that I've experienced, and then I'm going to get into how I actually got over it. So firstly, I'm talking about body-focused repetitive behaviors. BFRB.com defines this as a general term for a group of related disorders that includes hair pulling, skin picking, and nail biting, and affects at least 5% of the population. So a little background on myself. I have dealt with OCD as well as central language processing disorder, which is now known as central auditory processing disorder, and ADD. I've dealt with these conditions for about 20 years now, since the age of 12. For as long as I could remember, up until about age 28 and a half or so, I had gnawed at the inside of my mouth to the point of bleeding, and it took a long time for me to realize this, but it seems to occur from unconscious, unaddressed thoughts. Eventually, I came to realize that as these thoughts would arise, my tongue would be searching around in my mouth for a place to bite. Eventually, I would stop at the point of bleeding, and the inside of my lips would be pockmarked like the surface of the moon. As I eventually came to analyze the situation, it came to my attention that I was attempting to smooth out the surface, or like smooth out any scragglers that were left behind, which has some very psychological implications. Of course, this just created more mouth craters and eventually became a perpetual cycle of literal self-destructive behavior. I eventually came to notice that this was indeed a reaction to slight irritations or worries, and the instant those worries emerged from my subconscious, they made muscle movements start to occur before it hit my actual conscious brain. So the muscle movements would be concerning my tongue searching around in my mouth for other places to bite that haven't already been bitten. Which is crazy when I say it out loud, but that's kind of how these disorders go. And even after I became aware of myself chewing away at myself, I still couldn't stop it. Like I would actually say out loud, you should really stop doing this. Like this is not doing you any good. You should stop doing this. And I still would do it. Like another part of my brain would make an excuse to continue doing the action. I guess because it's so fulfilling or so subconsciously like smoothing, or that whole smoothing effect thing going on, which is just really strange. It became a conscious occurrence. Like I would be consciously aware of it while doing it, and still I couldn't stop it. And this is why it's called an obsessive compulsive disorder. It is obsessive and compulsory. And this was not my only compulsion. I also did things in odd numbers for a long time. Like throughout middle school and high school, I did things in odd numbers according to like spring and fall, and even numbers with summer and winter, which was really specific. And that would be like clicking my teeth or tapping my foot, tapping a pencil, anything like that. Once I did it on one side, I had to do it on the other side. And once I did it there, I had to do it again and again. And this is apparently very common. I hear a lot of people talking about this kind of thing. I think it has to do with, well, there's lots of speculation on this, but it seems that a lot of it just, it makes us feel better. It makes us feel like the world makes sense to me a little more now that I've done this thing. And of course, that's batshit crazy. Part 2, how I defeated my OCD. Okay, I'm going to just read this straight off my computer because I don't want to get any of this wrong. This has been the most impactful thing that I've experienced. It's been the disorder that's caused me the most public humiliation as well as personal distress. Around age 27, I tried a couple medium-sized doses of psilocybin and LSD and experimented with microdosing. After doing so, my central language processing disorder became much less prominent, and I was more aware of what was coming out of my mouth instead of just completely speaking unfiltered. Around age 28, I really began taking life seriously. I became more interested in the sciences, philosophy, and psychology. I really just wanted to have more control and volition over my life. I came to realize that I was becoming very subservient to the whims of my own neurochemistry. My own brain was... It seemed like my subconscious brain was calling the shots more than my conscious brain, and I didn't want to live like that anymore, so I started working on things. Around age 28, I had slightly better success with this problem as I became more conscious of it. I'd focus hard on the fact that my tongue was indeed searching around in my mouth for a place to strike, and I would tell myself, no, you don't have to do this. And it became more of a personal choice when I finally did. Now, towards the end of age 28, I began limiting it to one side of my lips and cheeks, so I would let one side of my mouth heal for a few weeks and switch to one side and then switch back. And this was very strange. There was conscious decisions going on with this, and there was also subconscious justifications going on, I guess. Most of the times that was the best I could do, was to limit it like that. Now, I should note that this has taken place all after the age of 25, which is when neuroplasticity is supposed to be dropping off. So the attempts that I'm making to make big changes like this are going to be that much harder, according to neuroscience. Now, this varies by the individual. At age 29, I took about 3 grams of psilocybin mushrooms the normal way. I just ate them whole. I didn't cut them up or anything in particular. So it wasn't like a super heavy hallucinatory effect, but it was definitely an intervention level dose, like when you start seeing the effects of addiction relief and reframing of past traumas. This is the dosage that seems to be most effective for that. At some point during this trip, I decided to focus on this problem and work on it. Now, I want to make emphasis on this fact too. I didn't go into the trip with the intention of working on this. So all the benefits that I got from this experience were solely due to... It seems very much due to the drug and very much due to my mindset after I had gone into it, like what I decided to do with the trip after I had entered it, which is kind of counterintuitive. They say that a lot of the effects that you get and a lot of what determines what you're going to get out of the trip is what you go into it with, mindset and setting, or mindset that you go into it with and the actual environment or your setting that you're in. During this trip, I decided to come up with a cheesy mantra or two and just recite them and see what would happen. And I also want to emphasize that these mantras I'm about to share with you, I didn't recite very much. I only said each one of these like 5 or 10 times, which also says a lot about the power of these substances. So I set myself down and deeply focused on the meaning of these mantras. The first thing I said was, this is your temple. Your body is the only machine that propels you through this world. You should nurture it and not damage it. I repeated, I will bring no harm to my body, and this is your vessel in life. You must come to love your body and mind, not despise it. You have no reason to harm yourself and cause the incredible structures of your cells any extra trouble. They already have it hard enough, trying to keep you alive. Now, I said this over and over, repeating it in different accents and different inflections. This has been very effective for me in memorizing information, is just repeating it and embodying it and like conceptualizing it in different inflections, like each time I change the way I say it. With each repetition, I said it slowly, all the while embodying the concept in each of these inflections as they changed. Now, when I say embodying, I mean visualizing my own mouth cells in a constant struggle to heal what my behavioral mind was doing to them. Now, that is a weird thing to be thinking about when you're tripping. If you have the effect of like spiraling thoughts when you're tripping, that would be something that I would warn against. Obviously, there are thousands of caveats that I should be giving for psychedelic intervention therapy or any of this. I'm assuming that you're going to be, if you plan on doing this yourself, you would be doing so with a trip sitter and after your doctor's approval. Now, this embodying technique seemed to work pretty well. The next day, I had 0 symptoms, and for months after, I had very, very little symptoms. Around after age 30 or so, it wouldn't really come back more than about 10%, and when it did, I'd have a lot more control over it. And since then, I haven't used anything else, and for the last couple years now, I've had no urges to bite or do any harm to my body whatsoever. This has been... I'm 32 and a half now, so yeah, it's been almost 2.5 years that I've been going strong like this. Now, this process of embodiment that I describe is not to insinuate that the brain is literally talking to every cell, or that our trillions of cells are trying to send some subconscious message up to the conscious brain. But perhaps this direct visualization method works along with the placebo effect. Now, every cell is regulated together with all the others according to our internal bioclocks that are set in motion by the signals from the suprachiasmatic nucleus. But I'm not going to get into that here. It does seem to concern believing in yourself and talking to your own mind at some level, which sounds like a bunch of hippie mumbo jumbo, but this is what seems to be at the core of major life changes and like PTSD relief and OCD and ADHD. There's this mechanism that's behind self-talk that seems to be very much influencing the placebo effect, or at least letting the placebo effect take place that much easier. Now, during this trip, I also recall a very commonly felt feeling, which is objective reasoning, or an open-minded objectivity, in which I thought, this is no way to get along in the world. This is not an ideal way to present yourself to the world or to integrate with it. Now, I imagine this type of mantra would do well with those that are suffering from germophobia, with the perspective widening effects of these high-dose psychedelics. Now, this story may sound kind of familiar to some of you who have heard of the works of Paul Stamets. This is the renowned mycologist that climbed up into a tree in the middle of a storm and recited a mantra himself. He just said, I will not stutter. I will not stutter anymore. I will not. And he did that over and over. And he came down from the tree like Zacchaeus, and he did not stutter anymore. He said he hasn't, and this has been for like a decade or something now that he's been good on that. Now, I actually got this idea from him. I emulated his method after I heard him give a speech on this very method that he used. I can't emphasize enough what a nightmare it is to live with a severe case of OCD, or body-focused repetitive behavior. This disorder can really make one feel like an animal. The experience of being pulled by a self-damaging compulsion it's otherworldly, and it connects you to a feeling of not having agency in your life. And if you have other disorders that are going on as well, it just adds fuel to the fire. Like, I can't even stop myself from biting my lips. I can't even stop biting my nails. Like, what's wrong with me? I'm unfixable. And I'm here to tell you, folks, that you're fixable. You can address these issues. There are thousands of methods out there. There are thousands of trained professionals that can help you work through the more natural approaches to working on these issues. I don't want to use the term getting over. That's such a loaded idea. But so, of course, I would advise you to seek help from professionals first before you do anything with psychedelics. These are not drugs to be played around with. I want to emphasize that this is something that, if you're going to do it, you should probably be experienced with heavy dose psychedelic use to begin with. And what I mean by experienced, I guess most literally, it means to have already had a bad trip. To have already gone through something that you have been uncomfortable in, so that you know that it's not going to be that bad, like it is just a drug. You want to be able to have already established a good relationship with your own mind, like have a good personal narrative that's open, objective, and also aligned with your personal goals. Part 3, advice, tips, and tricks. Okay, I just want to list a couple of things that can help relieve symptoms and make it such that there isn't as much temptation for you to bite. I want you to remember to brush your teeth regularly, because plaque buildup and mucosal layering and other factors often add layers to the inner mouth, which the tongue can feel, and therefore adds more of a temptation to bite. Also, I want you to be careful with lip balm, and lipstick. These can leave residual layers on your lips, and they can also create temptations to bite. But you should experiment, though. For some people with naturally dry and cracked lips, untreated lips can be more of a temptation. Fun story, I have one spot right in the middle of my upper lip that has never completely healed, and it actually rips open whenever I smile. So I get to feel pain every time I smile. Well, it's not every time. It's in the mornings when I wake up when my lips are really dry. Even if I use chapstick or use a humidifier or anything, it's just a spot that just won't heal. Or it takes me a few hours after waking up for this, I guess, to heal over enough for it not to bother me. I don't know, but that's one thing that I regret, is that I wish I had addressed this earlier, because I feel like this is probably going to be the way it is forever. Oh well. So also, using a humidifier can seem to help or hurt the situation. It actually makes this one spot on my upper lip worse for some reason. I don't really know how that works, but yeah, experiment with these things and see what works for you. If it makes it worse, obviously don't do it anymore, and if it helps, then it helps. I'm only going to list one major study that came from JAMA Psychiatry. They suggest that psilocybin may be effective in the much wider populations of patients that suffer from major depression than previously appreciated. So it seems that OCD and the general compulsory disorders can be mitigated by two major effects commonly experienced under the influence of psilocybin and LSD. The affordance of a wider perspective from more connections being made seems to allow for such rearrangements of our personal narratives. Now, every time I've done this has gone from a negative to a more positive outlook on life and perspective change. This is what most people commonly report under the correct mindset and setting, and under professionally guided psychedelic experiences. But of course, you can have unwarranted effects, so be careful. Again, speaking personally, my own experiences have radically accelerated my abilities towards organized, rational thought and objective perspectives. OCD acts much like an addiction, except the dopamine trigger is on us at all times. our hair, our nails, our skin, whatever it is. It's like a drug we always have access to, so it can be that much harder to put down. It would make sense that there's crosstalk that's developing between our conscious mind and our self-talk and our subconscious mind. The language centers of the mind are very nuanced, very intricate. The Broca's and Wernicke's areas, we've thought for a long time in psychology that those are the main areas of the brain that are responsible for speech and auditory mapping, but we're starting to find out that it's actually more distributed across the rest of the brain. Now, I'm not going to list a lot of statistics or anything from any major studies, but there is one study that was pretty profound that showed 70 to 80% success rate with the treatment of OCD via LSD and psilocybin treatments, whereas SSRIs have a 50-50% success rate, and many still retain symptoms after coming off of them. Also, 50% of the time, a placebo works just as well, which says a lot about the whole mind over matter concept. Anyways, that's all I have for now. I'm probably going to be talking more about this concept more in the future, but for now, that's all I'm going to say about this major life-changing event. If you feel this video to be worthy of monetization, feel free to hit me up on Patreon or any of the links in the description. And if you enjoyed this video, please feel free to subscribe and or share this video to help this channel grow. It's still very much in its infancy. I want to thank you so much for watching this video, and I hope to see you in the next one.